In this video, we are going to talk about hospital beds. Now, as caregivers, you're going to run across this. There are different variations in hospital beds. Some have electronic controls for the head, for the foot, and for height adjustment. Some may not. Some may have cranks for some of those adjustments. This bed in particular has a crank for the height adjustment. It does have electronic head and foot adjustments. So please be sure to talk to your doctor and your local medical supply store about your loved one's needs in this circumstance. So we're going to take a minute and show you the crank that adjusts the height of this bed. So as I mentioned, on this particular hospital bed, the height adjustment is not electronic. So what we're going to do, we have this handle here that's going to crank the height up. You might run into this, so I wanted to point this out. So what I'm going to do as a caregiver is I'm always going to raise this bed up to adjust so that it makes it easier on me when I'm trying to care for my loved one or my client. Now I'm going to go ahead and take this bed on up. There is going to be a limit to the height that it will go up. Again, this is the crank that adjusts the height of the bed. Now we will talk about the head and foot control of this bed. When you have a client that you're caring for that may need a lot of assistance getting in and out of the bed or sitting up on the side of the bed, raising the head of the bed is very beneficial for the caregiver. The other thing is it's good to raise the head of the bed just for pressure relief for position change. Now the foot of the bed can be raised as well. You might do that if you are elevating the legs for swelling, or if you actually have to move your loved one up in the bed. If it's okay to put them in this position, raising their feet a little bit or raising their legs, let gravity help you when you're trying to slide them toward the head of the bed. So that is the head and the foot controls on this bed. Next, we are going to talk about the bed rail. Depending on the hospital bed, the bed rail may vary a little bit. This one in particular is at its highest level. The bed rail is pretty good to have as a caregiver. If you have a loved one that can help you a little bit, they can help by grabbing on and helping assist you in rolling them over if you're bathing them, dressing them. This one is at its highest level here. What I want to show you is in adjusting the height. So what you're going to do is pull this little pin out. This has got 3 hole adjustments right here, but it will also go past the 3rd hole down a little bit further. This is one thing that I want to point out. On this particular bed, this is as low as this rail will go. If I sit on the mattress, the rail is still a good height if I am the loved one trying to get out of the bed. So I can get on the side of the bed, my thighs are not touching this rail. On some beds, this rail may not go down quite low enough, and I've run into this before, where the person sits up on the side of the bed, and when they get there, because of their body weight and the mattress and the rail, their thighs are hanging right here on the rail. This makes it very difficult to get over the rail and off the bed. So in that instance, what I'm going to recommend is you actually take the rail off of the bed. So the way you do that is, again, you're going to pull this pin. A lot of people actually don't realize the rail does come off. So you pull this pin out, you pull that all the way up. I usually set that end on the floor, and then you're going to pull this pin out and bring it all the way up as well. Now typically I will take this rail and I will put it right underneath the bed if there's nothing blocking down underneath the bed. When you go to put the rail back on, a couple of things that I want to point out. I typically will start at one end. I don't try to put both of them in at the same time. So I'll line up one end right here, and I'll go ahead and put that in a notch and let that click in. Couple of things here. This right here, the slot that this post goes in will turn. So let that help you in lining this post up. This will also, most rails will shorten and lengthen like this. So let that assist you in lining this up as well. You line it up like that, and you slide that right in there. So that's how you use a bed rail. A couple more things I want to point out. When you are working with somebody in a hospital bed, you always want to make sure and check and lock the brakes. You want this bed to stay stationary. The only time that you would take those brakes off is if you had to move the bed around at some point. But you want the brakes on, the wheels on the bed, so that stays stable. The other thing is whenever you are working with somebody, this is what we did when we cranked the height of this bed up. Now this is as high as it will go, but we want this height as high as it will go to accommodate the caregiver. Because when you're working with somebody in bed, you want to limit how much you are actually having to bend over to work with loved one in bed. So you want to get the height of the bed up. I know the cranking system sometimes can be a little bit cumbersome, but it is very important as a caregiver to take care of yourself so that you can take care of your loved one. So that's the details on the hospital bed. Please make sure that you check out the comments section below. We're going to add further detail and add anything that we've forgotten to say in this video.